The first thing I noticed was wrong was I had a lump in my throat. And I'm very in tune with my body, so I give everything 2 weeks. If something's not right after 2 weeks, I go see my doctor. And the first thing they did was just thought it was the infection. So they did a round of antibiotics, nothing happened. And then we did a scan and a biopsy and found out that it was cancer. Through my neighbor, Dr. Hartog, they got me to see Dr. Ho the next day. First of all, his reputation was stellar, but 5 minutes after being in the room with him, I knew that I was doing what I was going to do, and he said, you got to make a decision, but don't wait too long. I said, I made my decision, go ahead and set up the surgery.
He was several months following his initial surgery to take out his tonsil cancer. And then the physical exam, on the face of it, was just like the others had been, nothing really out of the ordinary, but just a very vague fullness that hadn't been there before on the back wall of his throat. I told him everything kind of looks good, we'll see you at the next interval. Then later on in the day, something was whispering to me, and then I woke up that night from sleep. Something was telling me it just wasn't right. So the next morning I called him up and I said, we need to check this out a little bit further.
Get a phone call, and it's his assistant said, Dr. Ho's right next to me, can you talk to him? And I said, of course. Here's a very, very busy doctor. He's calling me personally the next day, and he said, Robert, I didn't feel good about our exam yesterday. He said, I want you to go have a CT scan. So just immediately set all that out, went to have the CT scan, and sure enough, it came back positive. So the cancer had moved from my tongue into my throat and was against my spine and carotid artery.
We immediately made arrangements to get it out, which we did again with the robot technique. It allows us to see very much better and have much more dexterity in this small opening. So we can do it through the mouth, minimally invasive.
I never felt like I had cancer until the cancer came back, and the concern on them really concerned me. The process is tough enough to not have it as convenient and as easy and as well done as it is here. And the whole Winter Park team was fantastic. I would highly recommend that to anyone that's getting ready to go through or deal with what I had to deal with.